guys, welcome back to my channel in the Safe Zone. Thank you for tuning in today. In today's video, I am going to cover what are the early signs of dementia. Everything in today's video is for informational and educational purposes only. Let's talk dementia. Confusion, memory loss, and personality changes are just a few of the early signs of a person that is going through dementia. An umbrella term describing the symptoms of several different brain disorders that can interfere with one's ability to live independently. Depending on the cause, sometimes dementia symptoms are treatable, but in other cases, they are permanent or progressive. This is why early detection of cognitive decline is important, and the proper medical treatment might reverse or relieve symptoms. Here are some signs and symptoms of dementia. A long list of symptoms is associated with dementia, but many overlap with other health conditions, meaning that having some of them does not confirm that an individual is cognitively impaired. That said, don't hesitate to consult a healthcare provider if you or a loved one is showing signs of dementia, which can be cognitive or psychological in nature. First sign or symptom is trouble remembering new information. The second is confusion, particularly related to time or place. Third is disorientation. Number 4, changes in mood or personality. Number 5, getting easily irritated. Number 6, growing depressed and withdrawn. Number 7, trouble problem solving. Number 8, trouble completing tasks. Number 9, trouble organizing. Number 10, increased anxiety. Number 11, trouble communicating in verbal or written form. Number 12, trouble with physical coordination. Number 13, getting lost, especially on one's way to familiar places. Next, routinely misplacing commonly used items. Then we have exhibiting signs of paranoia. And then lastly, exercising poor judgment. Not everyone will notice these symptoms right away, and a checklist alone can't determine if a person has a dementia-related disorder. In fact, not even a test can do so. To make a diagnosis, a physician such as a neurologist, a geriatrician, or mental health professional will complete a comprehensive evaluation that includes a physical exam, a review of one's medical history, blood tests, and assessments related to behavior and overall function. Identifying dementia early might alleviate symptoms and allow patients to participate in clinical drug trials and plan for life in the future. Common causes of dementia. Medical intervention for dementia or dementia-like symptoms depends on the source of the problem. Although it's widely believed that such conditions solely affect elderly, that's inaccurate. People of any age can experience these symptoms because the causes are related to a variety of health conditions, from traumatic brain injury to Alzheimer's disease. Alzheimer's disease is arguably the most widely known form of dementia. Y'all get that? Alzheimer's disease is a form of dementia. It is also the most common cause, representing 60% to 80% of dementia-related diagnoses, according to the Alzheimer's Association. Although increased age heightens one's risk of developing Alzheimer's disease, 200,000 people living with the disease are younger than the age of 65. These individuals have what's known as early onset Alzheimer's or younger onset Alzheimer's. One of the first signs as Jacob-Creutzfeldt disease and Huntington disease. People with these disorders have dementia-like symptoms or develop a form of dementia. Let me say that again. One of the first signs as Creutzfeldt Jacob disease and Huntington disease. People with these disorders have dementia-like symptoms or develop a form of dementia. Traumatic brain injury. Traumatic brain injury, which develops after repeat head trauma, is common in athletes who have played aggressive contact sports such as football, rugby, or boxing. But these injuries can also occur in sports such as volleyball, cheerleading, or water polo. If certain parts of the brain are injured, dementia may subsequently develop. Symptoms of traumatic brain injury include memory loss, difficulty communicating, depression, and rage. Parkinson's disease. It is also possible for symptoms related to Parkinson's disease caused by nerve cell damage in the brain to form. People with Parkinson's often suffer from tremors, move slowly, and have trouble with balance and coordination. It is common for people with Parkinson's to experience dementia symptoms. Creutzfeldt-Jakob disease is a heritable disease characterized by the accumulation of proteins known as prions. It is a fatal condition that occurs very rarely. In addition to genetic predisposition, this illness can develop after exposure to infected nervous system tissue during a transplant. In cattle, it is widely known as mad cow disease, which humans can contract from eating contaminated meat. Signs include confusion, disorientation, depression, coordination problems, and difficulty speaking and concentrating. Huntington's disease is an inherited disorder in which nerve cells in the brain deteriorate. Symptoms include forgetfulness, depression, difficulty communicating, and difficulty with physical movement. This condition typically appears in one's 30s or 40s. While traumatic brain injury, Parkinson's, Creutzfeldt-Jakob, and Huntington disease are not reversible, a number of other conditions associated with dementia are. Having a brain tumor, nutritional deficiency, thyroid problems, or immune disorders are just a few. People with Alzheimer's disease, early onset or otherwise, report having trouble recalling information they've learned recently. This occurs because Alzheimer's compromises part of the brain involved in the learning process. Unfortunately, Alzheimer's is a progressive condition, meaning symptoms will worsen over time, but medical treatment can help manage them. Other types of dementia. Other progressive forms of dementia including frontal temporal dementia, Lewy body dementia, and vascular dementia, and it's also possible to have a combination of dementia types. Frontal temporal dementia, which is frontal temporal dementia, nerve cells in the parts of the brain involved in behavior, communication, and personality begin to degenerate. Thus, people with this condition typically have symptoms that impact their behavior, reasoning, communication, and or movement. Lewy body dementia. In Lewy body dementia, wads of protein accumulate in the brain. These proteins can also be found in patients with Parkinson's and Alzheimer's disease. People with this form of dementia might hallucinate, have trouble concentrating, or experience physical coordination and movement difficulties. Vascular dementia is second only to Alzheimer's in its prevalence in people with dementia. It occurs due to problems with the blood vessels that involve the brain. While people with this form of dementia may have difficulty reading or recalling, their most obvious symptoms are likely to be trouble with organization, reasoning, concentration, and thinking quickly. Then we move into conditions linked to dementia. Several other medical conditions have been implicated in dementia diagnosis. They include the previous mentioned traumatic brain injury and Parkinson's disease, as well as examples of conditions that can cause dementia-like symptoms to develop that can be medically treated and reversed. Preventing cognitive decline. Many causes of dementia are genetic, and the likelihood of exhibiting signs increases with age. However, experts still recommend that people do what they can to reduce the odds of experiencing these symptoms. And lastly, abstaining from excessive drinking and smoking in quantity, managing conditions such as hypertension and diabetes, and eating well and exercising are among many steps the public can take to stay on top of their cognitive health. This concludes my commentary today on what are the early signs of dementia. Thank you for tuning in to today's video. I hope this information was helpful to someone that may be suffering from dementia or a caretaker of someone that may be suffering from dementia. Thank you for tuning in today. I appreciate each and every one of you that hit that button to play. Please like the video and share the video if you will. If you are not subscribed to In the Safe Zone, please take the time to check me out. And if you like and see what you hear over here, please hit the subscribe button. This concludes my commentary. And as always, please do have a blessed, productive, and most of all, positive day. Until the next video, I'll see you later.